Enter the room.
Hello,
Hi, doctor.
I'm Dr. Firoz. I'm one of the doctor in this GP surgery. Are you Hilary Roster?
Yes, I'm Hillary, doctor.
So, can I confirm your age, please?
I'm 18.
Is it okay to call you Hilary?
Yep, that's fine.
Okay, nice to meet you, Hilary. How can I help you today?
Well, you see, doctor, I've been having this headache and it's been on and off for like a month now.
Mm-hmm. Okay, and it's how long it has been going on?
A month, like I mentioned?
Mm-hmm. Okay, and you mentioned to me it comes and goes. So, is each episode how long it lasts?
I mean, well, it's usually there when I'm resting at home mainly. And
Mm-hmm.
yeah, mostly when I go out for like a fresh walk, then it gets better. But when I come back,
Okay,
it's always somehow lingering there.
okay. And is the headache is going anywhere else in your body, any other parts?
No, not really, doctor.
Mm-hmm. Okay, and what kind of headache is that? Can you describe it for me?
Well, it's all over my head.
Okay. Okay. So, is there so one is scale of 1 to 10, one being the least pain, 10 being the severe pain.
Hmm.
How would you score your headache right now?
I would say around 4 to 5.
Mm-hmm. Okay. And apart from this headache, do you have any other symptoms? Like, do you have any fever?
No, not really. But I whenever I have these headaches, I kind of feel, fatigued, kind of dizzy.
Mm-hmm.
I also sometimes feel nauseous.
Okay, okay. And do you have any rash in your body?
No, not really.
Mm-hmm. Okay, and do you think this is the worst, would you say that it's the worst headache of your life?
No, not really. Yeah, I
Mm-hmm.
mean, it just keeps coming and going, usually when I'm resting at home, I keep
Yeah,
having
okay.
these headaches.
Okay. And you mentioned to me when you are going to your home, that time it's getting worse. So, is there any, where do you live actually? Is it the apartment?
Yes, I have a rented house.
Mm-hmm. And who do you live with?
I have a couple of roommates that I live with.
So, by any chance, is there anyone else who is having the same kind of headache?
Yeah, usually even they've been also my flatmates have also been housemates have been complaining of the same. Sometimes my friends when they come home they also say they have a headache. I think this is the aura of the house, I guess.
Okay, so how long you have been living on in this house?
About a month, doctor.
Okay, so you came recently, and is
Hmm.
there any recently any maintenance on this house?
Well, I did install a new heater. There was also like a month
Okay,
back.
okay, and is there any carbon monoxide alarm in your house?
No, not really. We didn't set that up.
Mm-hmm. Okay, so do you feel drowsy?
Um, well, I kind of feel dizzy sometimes when I'm having the headache.
Any muscle pain in your body?
Not that I've noticed, doctor, but sometimes I have some difficulty walking inside the
Mm-hmm. Okay, I
house.
can see. Okay, and so do you have any medical condition?
No, no, doctor.
Okay, and anyone in your family having any long-term headache or any migraine?
No, not that I know of.
Are you on any kind of medication?
No, doctor.
Okay, I'm just okay. What do you do for the living?
Well, I go to uni.
Okay, and I'm just going to ask you some personal questions. Just to, it's important for the consultation.
Uh
What
huh.
do you smoke?
Oh no, doctor, I don't.
Okay. And do you drink alcohol?
Oh, well, sometimes in moderation, I would say.
Okay. How about your menstruation? Is it regular?
Yeah, it's been regular.
Okay. Is there any relation? Is this headache with this menstruation?
Not really. I wouldn't say so.
Okay. So, Hilary, do you have any idea what might be the cause of your headache?
No, not really, doctor. I was hoping if you could shed some light.
Yeah, definitely will look into it. And it has been going for 1 month. It's a quite long time. How this has been affecting you?
I mean, most of the times when I have to come back from uni and get some work done, it gets really difficult for me to do that.
Okay. So thank you for answering my question. I would like to examine you. I'd like to check your oxygen
Two
level
minutes
in the blood,
remaining.
your pulse, your blood pressure, and your temperature. Okay.
Mm.
And yeah. So Hilary, from what you have said, and after the examination, I'm suspecting you are having this carbon monoxide poisoning.
Oh my god. What do you mean poisoning? Somebody's been poisoning
Yeah,
me?
yes, as you okay, so let me explain for you. So carbon monoxide poisoning, it means that it's usually it's a colorless, odorless gas, but we are usually normally we are taking it. But if there is a excessive amount of inhalation of this gas in our body, this causes some symptoms like this headache, your feeling of this nausea or vomiting, as you already experiencing it. So. I think you shifted to a new place, and as you mentioned to me that your maintenance is going on your new home. That's why you got it. Am I understandable to you?
Yeah, you mean my new heater?
Yes.
Oh, I see. What can I do about that, doctor?
Yes, I'm afraid it's a medical emergency. Okay, so I'd like to send you to the emergency department immediately. Because so, when do you think you can go there?
Yes, absolutely, if you say so.
Yeah, so when you go there, they will
Mm-hmm.
check your oxygen level in the blood, like carboxyhemoglobin level in your blood, and if it is above the normal level, they will give the oxygen, high flow oxygen, okay,
I see.
and they will monitor you,
Mm-hmm.
okay,
Yeah.
and if everything is okay, you can go back
Move
to
on to the
your
next
home.
station.
Okay.
All right, not bad, not bad. That was very good. Good
Okay.
performance, I must say. And so, a couple of things. You did manage to understand what the case was. You ruled out a lot of things. That was very good. And you also understood that, how it's affecting her life. So, that is a holistic care. That's good job. And yeah, I don't think I have much to say about this. But just that
But I think I shouldn't ask much Didi when I reach there, yeah, because I could
because
use that one in my management part, safety netting, all these things.
absolutely, that's absolutely. I think you gotta hang up this now.
Yeah, I understand that
Yeah.
because, okay,
Because mainly because you did rule out a lot of important things, but you are also telling her, the person, as soon as you understand what it is, you need to get to management because you've already ruled out.
okay.
Because you kept dwelling on certain questions to make sure what it was, right? Because
Yeah,
you
this is
understood.
the worst part. We are always taking history more,
Yeah.
so yeah, we
Because
can't.
I would say ask 2 to 3 questions that would be relevant to the disease itself. You ask that your flatmates also have this. You've been having nausea, vomiting. You usually have it when when you're at home. Then you understood what the case was, right? You have a carbon monoxide alarm. No, okay, fine, good data
Hmm,
gathering, good job. Now that's it. Move on. Now you start
okay,
management. Now I suspect you could be having something called carbon monoxide poisoning. The way you dropped the diagnosis was something that threw me off. Like I think
Yeah,
I
it's a
suspect.
long, quite long explanation I gave.
No, because if you're giving the explanation in these cases, what you can do is, I suspect you might be having something called carbon monoxide poisoning. Pause and ask them, do you know what it is? Would you like to know more?
Mm.
Right?
Okay.
So then that would itself give me a chance to say, what are you talking about? Am I poisoned? It's like, it does sound like that,
Mm.
but this just means that the carbon monoxide level is more than what it needs to be. And I suspect this is because of the new maintenance that is happening in your house, because of the new heater, which has a tendency to release this gas, this odorless, this colorless gas into the environment that you're in. Right? Certain things, this is an emergency condition, we will have to admit you immediately, and we have to flush out that carbon monoxide from your blood. Right? That's something that we have to do. And we will be now, so that is a immediate treatment. Now the further treatment, what you can do is install the alarms, because you understand there's no alarm.
Oh,
So
okay.
install it, so because you
Yes.
first of all data gathered for it, so then bring it back in management. Good job, the good data gathering. Bring it back in management. Right? So that if this happens, you would know. Right? And
Okay.
let's look at the examiner's checklist. All right, see, it's all it's all green over here. So I would say you asked most. So you also asked for smoking history. Very good. And that was all relevant. 100% all
Yeah, I couldn't
smoking.
finish this management part. Yeah.
Yeah.
But you covered the major points, which is the what will they do at the accident emergency, all that you covered. That's really good. The main thing is you forgot safety netting and preventive measures.
Yeah.
That's very important.
Yeah. So if you could just always like 2 minutes, even though you're doing your management, try to wrap it up with these things,
Hmm.
because there's always
Okay.
something that you can give in this, in every
Hmm.
station. Otherwise, this case I think went without a hitch. That was very good. See, that's what I'm saying.
Oh,
You know all the cases, you know how to do them as well.
but I don't know how to this give in a good way.
I
I
mean,
I
No,
think
you.
this
that
same
is
thing
something.
happened with me.
See,
Yeah.
that is something that you'll always feel. Even if
Hmm.
you're doing a consultation in real life, you feel that I could have done this better.
Yeah, you can never get a perfect consultation. The only thing, see, you're actually the way you're doing it is also really good. The way you're delivering the way you're delivering the sentences, the phrasing is everything is really good. You're also reacting to the emotions. Your signposting is really good. Only mistake you're doing is data gathering for too long. That that's
Yeah.
that's not a problem at all. You just practice some more. Make sure you rush to management. That's the only thing. That's a mistake everyone does. It's
In
fine.
fact, once you get what the diagnosis is, head on to management, because you have
Yeah.
4 marks waiting there for you.
Hmm.
Like, you'll be asking what, one or two questions that will give you point 0.5, some 0.25, maximum 1
Actually,
mark.
about this, what happened, like whenever we are practicing, like the all this examining, what we are doing, because we have this always in mind for like any kind of DD, we are keeping all this headache DD. Yeah, so that's why it's how we incorporate with us. So it's very difficult. I know this is, but still
That's true. That's
excluding.
true.
This is
In
not
fact,
good. I know.
I would say, once you understand what the case is, rule out the most dangerous DDs, like the
Okay.
subarachnoid headache. The subarachnoid headache. See, you've already asked the severity of the headache. I said 4 or 5. Then there was no
Yeah, so
point
it's
in
not
asking what was
necessary.
the
Yeah.
worst headache. Like, of course, it's not my worst headache. My worst headache will
Yeah.
be at 9 and 10, right? So that was an
Yeah.
unnecessary question there. Right. So if you are having any other radiation, does it radiate to the jaw? Get all that information out. Do you have any other symptoms? So, the dangerous points that do you have any weakness in your face? Those are the most dangerous ones. Once you've ruled out the most dangerous ones and you've understood what your diagnosis is, move on. That's it.
Yeah, you don't
Okay.
need to rule out every single differential. Just make sure you only need to rule out at least two very dangerous ones, and then two common ones. And if you still don't get your diagnosis by then, just move on. It's fine. You nobody will. If you don't get the diagnosis after trying to rule out 4 or 5 diseases, it means that it's a difficult case. They don't want you to know the diagnosis. They just want to see what you will do in the management.
Yeah,
Because
I
there will be
remember that.
cases like that. You make sure
Yeah.
you remember that too.
Because the cases where you're asking a lot of questions, those are a very difficult case and it might have not come before. And also, it is one of those cases where you might not know the diagnosis. They also want to see what happens in situations when you don't know the diagnosis. What are
Yeah.
you going to do?
They want to see what you'll do. You
Yeah.
can't just randomly say some diagnosis very confidently.
Yeah,
You have to
okay.
be very careful. You have to say, I'm not sure, but
It
I'll talk to
can be
my
this to
senior.
this, but we'll need to do further tests. I'll talk to my senior who can come and assess your condition. Right? Because see, what they are trying to see is if you are recruited as an NHS doctor and if you're working in the NHS, on your first day, will you cause a lawsuit? Is that likely to happen? Like, they need to be protected from their side, right? They're not just hiring anyone, isn't it? So, that's why you when you're rule out the most dangerous things that it can be associated to. And once you start finding out what it is, then head on to management, because management has 4 marks. Nobody realizes that. I mean, I know all the practice partners that we get, they also end up dwelling on DDs and
Yeah, same.
it
Yeah.
it always happens. Even we also had that same problem. That was the one of the main inspirations for us to build this tool, because what we are trying to tell people is that give 4 minutes for management and 4 minutes for ma- uh, 4 minutes for data gathering and 4 minutes for management. Because if you see the checklist that we have made, it's extensive in a way where it has almost equal points for data gathering and equal points for management. So if you don't cover enough points for data gathering, you still have management, right? You can still pass the station. And the rest is
Yeah.
interpersonal skills, where you basically have to be nice. Just be nice and professional about the way you're conducting your consultation.
Okay.
It was really good. And make sure we'll send you the feedback. Make
Please like and subscribe to TuringMedSchool. Good luck with your preparation.